it doesn't really do what you need to do it the right way.
Mm-hmm.
It doesn't do what you do to do.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax, HIPAA help is on the way.
Hi, I'm Dee Dee Dunlap from Perkins County Health Services in Grant, Nebraska, and you're listening to the Help Me with HIPAA podcast.
Thank you for that intro, and welcome to the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs and Security First IT. Joining me is Donna Grindle of Cardin. Good morning, Donna.
Good morning, David.
Top of the morning to you.
When you pop off with things like that, it's going to be a good recording.
Yeah. Yep, it will be. So we have to hurry through this one. You're doped up on Benadryl.
Yep. Having a little allergic reaction to something, got to move along.
Yep.
I'm sensitive that way.
Well,
whenever I say I'm sensitive, people laugh.
Yeah.
But I am. I'm allergic to a lot of things. I'm sensitive. Anyhow.
So in today's show, we're going to cover some interesting news and things that we got from the Safeguarding Health Information, Building Assurance Through HIPAA Security conference that you and I both attended online, which, we talk about this every year. They have an annual conference held by, NIST and OCR, and they always cover some good stuff, and we always come back and do an episode on it. So that's what we're going to dive into today.
Well, it's where we learn the stuff we keep in our pockets. It's some of our secret sauce.
Yeah. So, a lot of it gives us information on kind of what's to come, but we certainly get to see into the minds of some of the people that's involved in the security aspects and what HIPAA is there for and all that. So it's informational in that regard. And the other part of it is we get to yell, "That's right."
That's what I say.
Yeah, it's like, I'm not sure if they're listening to the podcast and getting the stuff.
Yeah, that's what you
or if we're listening to them and getting stuff.
I know, right? But the good news is, we're listening to the people who are deciding the rules and how we move forward with this stuff. And we're on the same page all the time, unless it's something new, and there were new things. It was great. But there were several little, catchphrases that we got in this one, and HIPAA is the floor, not the ceiling.
Mm-hmm.
That really stuck with me, and a lot of people used it later after Dir Severino said it in his keynote.
Mm-hmm.
So,
well, it completely flips the understanding of what you're doing when you're building your HIPAA compliance program, because people think that, that's the gold standard. I've got all this HIPAA stuff covered. This is the gold standard. And now what they're saying is, no, that's the bare minimum. That is not the gold standard.
And we've been trying to say that for a long time. So it was great to hear it put in a way that you can't, it's the floor, not the ceiling.
Mm-hmm.
So, and it it's an open atrium.
Yeah. Well, what's really kind of scary though is when you think about those organizations out there that are already doing the bare minimum of HIPAA, which means now you're doing the bare minimum of the bare minimum.
Hadn't thought about it that way. So you're doing the subfloor.
Exactly. And we know a lot of organizations that is their business model, to go out and help IT companies or help healthcare organizations to get to that bare minimum, so they can say, we've got the bare minimum covered, so we can say we've got it covered.
Mm-hmm.
And so now, and we've said this before, but we've heard it now from the director of OCR, they're doing the bare minimum of the bare minimum. Kind of scary.
Mm-hmm. Your minimum service provider.
Yep. So maybe now they're the minimum service provider. But anyway, so we'll get into all that here in a little bit. But what other kind of announcements do we have before we dive into that?
Well, this one comes out, when this one comes out, the very next week, we'll be doing the boot camp. So then, it's like, when will your next boot camp be? Really? Because everybody's like, I can't make that one. I want to go to the next one. And we release it, months in advance. And, it's always a problem. So we don't know.
Yeah. There's never a good time. But I will say, if you're planning on coming in 2020, it's a good idea to go ahead and get it in the 2020 budget.
That's right. That's what we told folks. We did get a question, somebody saying, when is it? How much is it? I want to put it in the budget. And so the bottom line is we're going to do 2 next year, one in the first half of the year and one in the second half of the year.
Yeah.
And the price is probably going to stay the same, but we don't know. I mean, if at least one of them will be here in Atlanta again, and the prices will be the same. If we go somewhere else, different story.
Yeah. We still haven't figured the logistics out on that one yet.
Mm-mm. So there's the answer. So put it in your budget for 2020 at the full price, and you will probably be able to get less than that, and then travel to Atlanta, and we'll have something you can work with.
Mm-hmm.
There you go.
Absolutely.
So we'll see you in 2020.
Yep. And the only other announcement I have, which is not in our show notes because it's not 100% yet, but I'm pretty sure it's going to happen. It's going to be, I don't have the exact date, but it will be the first week in December. OCR is coming to Charlotte, thanks to Donna hooking me up with OCR. So the OCR is coming to Charlotte. They're putting on a talk. They're doing 2 sessions. One's going to be about HIPAA. The other's going to be about some type of civil rights, something. They don't even know exactly yet what they're going to be speaking on. But it seems like they got some initiative to go around to some of the major cities and start trying to do some type of training for organizations.
Yeah, like a town hall kind of thing.
Yeah.
That's awesome. And we'll have an OCR rep with us at the end of the boot camp doing a Q&A. That'll be nice. And we're working on some other interesting things. So we'll see how it all rolls around.
Yeah. But it would be worth, for you listeners out there, try to find the nearest OCR office to you and see if they're having something that's in your area, because it would give you an opportunity to go out and listen to what they have to say and, ask questions of OCR investigators. This might be one of the few times you get to talk to them on your own terms. Let me say it that way.
You can ask them questions and email them, and they are generally very helpful.
Yeah. Well, some people are like, I don't even want to be on their radar. I don't want to even ask a question.
Somebody said, I don't want them to know what I'm doing. I was like, you don't tell them.
Yeah.
And
hypothetically.
It's hypothetical. It's not like they immediately radio the main office and send investigators. So
yeah, create a fake Gmail account. Email them.
Nah, they're busy enough.
Yeah, that they are. All right, so before we get into that, let's hear a word from our sponsor.
Cybercrime is a multi-billion-dollar industry and growing. How confident are you that your computer network can withstand a cyber attack? Can you afford to take the chance that what you have today will protect you? Call us and find out if the cybersecurity in your business is something you should be concerned about, or if you can rest easy knowing your business is protected. Visit us online at securityfirstit.com. That's securityfirstit.com and schedule a time to talk.
Did you know that 83% of healthcare organizations report a strong negative impact to their bottom line after a data breach? So many doctors think that they're HIPAA compliant and have nothing to worry about. Many of those organizations thought the same thing before it happened to them. Call Cardin today at 678-292-5001 so they can assess your practice and help ensure you are protected and prepared. Visit cardinhq.com to learn more. All right, Donna, so let's dive into why HIPAA is the floor and what else OCR and NIST had to say about all the fancy HIPAA stuff.
Yeah, HIPAA stuff. Safeguarding information. Well, we did have the OCR was involved in multiple discussions, NIST and ONC for Office for the National Coordinator, which is separate from the other two. But again, this stuff was involving specifically technology and security issues, yet we still had multiple sessions where they were talking about privacy. So that tells you something. Security is all about doing what you need for privacy. And Roger Severino, the director of OCR, kicked it off and was doing more of like direction and those kind of things. He's my kind of speaker because he said, I use the slides to illustrate things, not to give you the words that I'm going to stand here and read. And he moves around like I do. So, but he had a big boot, like a
yeah, the medical boot.
Yeah, like the big cast-looking boot sitting on the table. That's what he brought up and sat down. And he started by telling the story of tearing his own Achilles tendon playing soccer. And I loved it when he said, and my foot was flopping around.
Yeah.
But the net of it is he is at the doctor's office and he has to leave. They're not like doing emergency surgery. And they show him this boot and explain to him how it works. And do you want us to do it? And he asked how much it cost. And it was $423. And he said, but my choices were leave on crutches with your foot flopping around or get the boot. So he did, but then he went home. And of course, then he just looked on Amazon for the exact same boot. So the $423 boot he could have gotten next day with Prime for $70 on Amazon. Yeah. And so that was his lead in to they're looking for different ways that they can use HIPAA regulations to address providing information to patients like transparent pricing and stopping surprise billing and all of that. So I thought that was interesting that they're looking at ways to apply HIPAA to those kinds of problems. And, that led straight into a lot of the issues with information sharing, which again, an area that they're looking to use HIPAA. And he went back to the story he told about his mom that he did at the HIPAA summit earlier in the year. She's from California, got sick in D.C., visiting him, and just getting all the paperwork done was what he went through then. And he told the story about they were telling him he couldn't get the medical records, and he wanted to say, do you know who I am? But clearly the person didn't. I mean, if you had a call and he told you that name, you would know. But his other thing that they're looking at is having the doctors, there's this confusion of HIPAA won't allow me to send things, and it's treatment between two doctors. And the patient said, this is my primary doctor, and I'm out of town, and will you send the records? No, that doesn't just automatically happen. And sometimes they charge patients a fee. Some do it for free. Some send certain things and not others. And so he was talking about them finding ways to apply HIPAA to make sure that there is sharing of information. And then, of course, touched on patient right of access, since that's their initiative. So along with his message of HIPAA is the floor for privacy and security, not the ceiling, was that then was used multiple times by others, but also that we got to figure out a way, and we've mentioned it, we've discussed it. How do you educate the public on what their rights are and what they should expect?
I don't have a good answer for that other than, you just have to keep putting out information, but it has to be somewhere where they're going to, they have to run into the information. They're not looking for it.
And maybe that's something, I don't know. I've got some ideas. I'm playing with some ideas, but that's a nut we got to crack. Then there was a whole section where they talked about apps And, another area where there's confusion that, this is one of those where I'm like, that's what I say.
Yeah, it just depends. It's a fact-specific determination.
But making the point that if a patient chooses to use an app, HIPAA doesn't apply. But if a provider or payer is offering the app to their patients, then HIPAA applies to the app. If PHI, because PHI is going to be involved.
Even if it's the same app.
Yeah. It's how does the patient get it? And I did get a kick out of one of the panels where they were talking about apps, and an OCR person, I don't remember which one, but said something is HIPAA compliant, and then paused, and then she goes, yeah, that's a term that always makes us cringe.
Yeah. Yeah, it does us as well.
Yeah, so they were talking about, the 21st Century Cures Act, totally separate requirement, but it's all about information sharing. And I found it interesting that one of the things they pointed out is, there's this new $1 million penalty for being an information blocker.
Yeah.
And then they said, we believe there'll be a high likelihood that most information blocking actors will be covered entities or business associates. Because, yeah, they're the ones they're supposed to have it, so I thought it was pretty interesting. Oh, and I don't know. I know David kept getting distracted with work during this, but hopefully you saw this look on his face, which was great when one of the questions asked Severino is, the security rule hasn't been changed since 2005 and things are very different. There's the NIST CSF and other things now. And is it time, or are you talking about changing the HIPAA security rule? Did you see that part?
I didn't. I missed that.
So first he's talking about, we can't put specifics in and And then all of a sudden it was like, it was like he got the answer, but he paused for a minute and the look on his face was almost like, the bottom line is we can't get people to do what we just said is the floor.
Yeah.
And if we raise it, what's the point? If they're already not doing a risk analysis, our number one problem is still not doing a proper risk analysis. There's no sense in raising the floor because they're not going to do a risk analysis. I'm like,
yeah, because people are looking at it and they're making comments like, well, there's parts of HIPAA that's vague, and it does, parts of it doesn't apply to technology today because it's changed. And okay, that's fine, but you're talking about, step 15. You hadn't done step 1.
And that was his point. It's like, you're supposed to start at step 1, not jump to 15 or 20 and then complain about it because you don't understand it. And it's about reasonable and appropriate and all these kind of things. So there were some good quotes that came out of the OCR folks. We're not out to bankrupt companies to make a point. And more significantly, Severino said, we do not have monetary targets.
Yeah.
How many times do you hear people, they're just trying to, get money out of me?
Yeah. They got to pay for whatever.
Yeah.
Yeah. As well as I do, even with all the big ones you see, it is not a drop in the bucket to cover the expenses of the OCR.
No. And the thing is that they're not even fining them. These are settlements. Basically, where they're going to not admit they did anything wrong, but fix everything.
Yeah.
But he did mention there was a new civil money penalty case coming out where they said, yep, we did that wrong and we'll stroke a check rather than do a corrective action plan. He mentioned it and then it came out like 2 days ago.
I do have a question going back to the the 21st Century Cures Act. They mentioned the information blocking and the $1 million fine. Is that going to apply to situations where sometimes we see an EHR company that's holding on to the data and not letting the covered entity have access to it because there's payment issues or whatever happening? Is that going to be part of that information blocking?
I believe that will be the intention. Will it be the result? I don't know. But we know that is a significant problem because they won't give you your data so you can move to another product.
Mm-hmm.
And that's just, flat out outrageous. And so the 21st Century Cures Act is trying to fix that and make them say, this is my data, not yours. And
right.
You need to work with me.
Well, not just that, but it's oftentimes hindering patient care. Right.
Yeah. So I believe we'll see something that attempts to do that. The question is when it's finally done, it started here and that looked good, but when it's finally done after it's been picked away at, will that be the end result without a lot of loopholes? I don't know. I think, fingers crossed, that's the intent. Some other quotes from OCR. So Severino was the kickoff, and then it ended with Serena Mosley Day, who is like in charge of enforcement stuff, and she was going through that. And she had some great, when they say things, there's something behind the scenes.
Mm-hmm.
They mention stuff. That means it's stuff they're seeing. And she said, she's 3 times in a row, she just stood there and said that the notifications have to be made without unreasonable delay. And she was talking about our breach notifications.
Mm-hmm.
And then she paused and she said, the notifications have to be made without unreasonable delay. The notifications have to be made without unreasonable delay.
Yeah, I remember when she did that because I was like, okay, we get it. Apparently, this is an issue.
Yeah. She's like, if 5 days afterwards who the patients are, what happened, you send the notification then. You don't send the notification on day 59 at midnight.
Yeah. Yeah. She made it a point to say 60 days is the maximum. That's not what you should do.
Right.
And I think that's what people do. They go, we have 60 days. Well, no, you have without unreasonable delay is what you have. It just can't go past 60 days.
Right. So, there's a lot of unreasonable delay going on.
Yeah. There again, 60 days is the floor.
It's the floor. But, the point was this is about patience, and it was very clear at the end of Severino's session where he said, this impacts the public's trust in the entire healthcare system.
Yeah. Well, this is also patient care. The quicker they are notified, then they can take care of whatever has to happen after that. But it is still a patient care issue. Breach notification is still patient care.
Indeed. But, there were a lot of topics, but they all came back to things like training and understanding the rules. So the, notification needs to be made without unreasonable delay, those kind of things. And, but then, there was a great deal of discussion on phishing attacks as the prime threat vectors for all of healthcare. And many people made that. And they talk about OCR is actively tested. Those stupid fake tech support scams, those make me crazy.
Yeah.
And people, seriously, I beg you, do not let someone connect to your computer unless you're certain who they are and who they work for. It isn't Microsoft.
No. Yeah. I don't get that. I just don't get it. Especially when they're paying an IT company already And they still let Microsoft in.
I know.
Air
I know.
quotes Microsoft.
Right. I love it that someone I know did that and they tell someone else and they say, don't tell Donna.
Yeah. Don't tell them.
I'm embarrassed.
Well,
But-
it's anything that communicates with you, whether it's a phone call, an email, text message, if it invokes any type of emotion, fear, uncertainty, doubt, all those other things, any kind of emotion, if it invokes that, yes, then you should stop and slow down and take a few minutes and decide what to do. Do not respond immediately. That is what these things are there for. In fact, I would say 90-something% of the time, if it does invoke emotion, it is absolutely a phishing attempt.
Mm-hmm.
Even if it's a phone call, it's probably a phishing.
Yeah. I get a call from my sister who says, I keep getting this. It was the 2FA text from Facebook. I keep getting this. And then this guy calls me and wants me to give him the code. He says he works for Facebook and he's trying to fix the problem. I was like, no, you hang up with me and you go back to the guy, because she put him on hold to call me. And she goes, that's why when I said, I got to call my sister, she works in IT. And he's like, no, just give me the code.
Yeah.
But I said, go back and tell him to stop being mean to people and hang up.
Well, a lot of times, if you just say, well, let me call you, of course, if it's a call, you can say, let me call you back. Well, they hate that because oftentimes they're spoofing their number anyway. So you exactly. Can't call them back. If you call the number, you'll get somebody different. But you got to be careful with any information you give.
And their 2FA worked right there. That's why we tell you to do it. That worked. And then, of course, I had her change her password because that's a whole nother story. No one believes me, not even my family, when it comes to passwords. But they believe me when I say 2FA. And that was an example of it actually working. So it's great.
Mm-hmm.
So it's the people.
Yep.
If you don't have the human side covered, technology may be virtually worthless. That was a good point.
Mm-hmm.
And training is key. That was mostly Day again. She cracks me up. Training is key. And it is key that it is targeted to the individual.
Yep.
What have we said about you don't just keep saying this is what HIPAA says and that's your annual training? It doesn't work.
No, absolutely.
So we got HIPAA is the floor, not the ceiling. Breach is not the only enforcement efforts we have going on. That was interesting.
Mm-hmm.
That we may show up at your door and have nothing to do with a breach. In fact, they were going through and it's like equal number breach and patient complaints, or we saw you on the news.
Mm-hmm.
And another point, if we do an investigation, we will not just look at the breach or the incident that brought them in. We will look at your whole HIPAA compliance program, the actions you took in response to the breach or the incident and its aftermath. So you're going to look at the big picture. What were you doing before? What'd you do during? What'd you change after?
Mm-hmm.
Risk analysis, we heard that. And Severino said, don't be asleep on the job. Always be ready, be aware, be awake, be enthusiastic about protecting patient information. I think you and I are maybe the only ones that are enthusiastic about it.
Yeah, that is true.
Sharing information for treatment purposes, they are far more lenient than other purposes because it's about saving lives and caring for people properly.
Mm-hmm.
Other purposes, however, that's the minimum necessary. Signing a BAA does not make you a BA. The work you do makes you one. I think we just covered that in our Halloween episode, did we not?
I think we've covered that 200 and something times, maybe 228 times. Ain't this the 228th episode?
228.
I mean, yes, we talk about that all the time because, I still see it in forums. It's like, oh, I didn't sign that. So, I'm not a business associate. Or it's even worse when they'll just say, just sign it and that way you can do the work that they're asking you to do.
Yeah.
No, it's
Yeah, it was upsetting to say the least. But that's a lot of the stuff that came out from the two OCR specific, activity, enforcement, direction. Again, it was focusing on this is about people's confidence in the healthcare system.
Mm-hmm. Yeah, and if they lose confidence in a healthcare system, the results could be that people don't get treated and they die.
Mm-hmm. And we end up with bigger public health issues.
Mm-hmm.
So it's ridiculous that, it takes people a long time to get there, but our tagline, it's not about compliance, it's about patient care. Maybe it needs to be. It's not about the floor, it's about patient care. They also had a panel on HICCUP, and there was so much in that. We're going to do a whole separate thing. There's new guides that are coming out. They're updating things. That's going to be its own episode, because there may be even more cool things that we have to share.
Mm-hmm.
And it was awesome. The Verizon Data Breach Investigation Report, they had one of the the handful of people, and she's been doing it 7 years. I don't remember. She's been at it for a while. She's actually a number cruncher and one of the ones that tracks this stuff.
Mm-hmm.
And it was pretty cool. We've reviewed the report. We see the things in it. So it wasn't, she wasn't covering that. She was covering more about the big picture of the data. So she said that they believe and they know for a fact that the numbers on that report, while we point out how terrifying the numbers are, she pointed out it's the tip of the iceberg.
Mm-hmm.
Because there's potential breaches couldn't be confirmed, so they didn't include those. And then in the other industries, if they're not required to report breaches, those numbers are going to look way lower because they don't tell anybody.
Well, we know even when you are required to report, there's still a lot of them not doing it.
Exactly. And another stat, attackers are able to fully compromise a network in less than 7 days, almost 100% of the time across the board. Healthcare was a little bit better. In 7 days, they only got 80% of the network.
Oh, that's good.
20%, we don't know which 20% they weren't getting. Maybe the financial. But again, she brought it back around to training and phishing. If you're not actively training your staff to deal with phishing, you're in trouble. And speaker after speaker brought that up.
Mm-hmm.
Phishing is the king of social attacks, she said. If your only defense is to tell people not to click, you will fail.
Yeah. And which, makes me believe that if something should happen and you're not doing phishing testing and training, then you're probably going to have a problem, because now they're out in the public, OCR is saying, you better be doing this.
Yeah. We had, how can I put this? We are aware of a group that quit doing phishing testing because the person that got to decide if they were going to do it or not kept falling for the phishing. And so then they decided that this was a waste of time. But they were the worst infringer, Mm-hmm. They clicked every time. And so they're like, it's a waste of time. I'm not learning anything. All right. So again, phishing is key. And I thought it was really interesting because, I'm sure these we don't learn about as much, but she's talking about, this is all about organized crime in a lot of ways,
mm-hmm.
And she was talking about that organized crime is actively recruiting individuals in jobs that have access to data. Doesn't matter what. They're actively recruiting and offering to pay them for using their access and getting them in there. And last year, Accenture did a survey, and 21% of provider employees said they'd take the money. 29% of provider employees said they know somebody that's doing it.
Wow.
And then went so far as to say that they're now even having people get trained in the jobs and then sending them into a new job. They go in and get hired with the entire reason they're taking the job is not to get paid to do their job. It's get paid to do their job so they can steal the data.
Well, this goes back to realizing that it is not somebody sitting in a cave somewhere or some kid that has nothing to do. It is an absolute business.
Yeah.
It is organized crime, and it is big business, and it is not going anywhere.
Mm-hmm. And then that's a great segue into the other thing they talked about, AI. And AI is amazing. That ability for artificial intelligence where it looks on its own. You don't have to you don't have to come up with, hey, I wonder about blah. It will see it and go figure it out. It will read information and evaluate it and make decisions. And, they had a stat that said that the machine AI tool that reads x-rays, those kind of studies was 100% accurate when humans made mistakes in the testing they're doing. So all you radiologists, listen up. But, it was we're getting more data every day. And you think about how much data is being collected about you every single day. Most people don't realize just carrying your phone around is collecting massive amounts of data.
Oh, yeah. Yeah, I heard something fairly disturbing on phones the other day. Uh-oh. This has nothing to do with the conference, but I was listening to a podcast called Hackable. And the premise of the podcast is they pick a device on each episode, and they see how hackable it is.
I love that.
And of course, most of them are IoT type devices or whatever, but this one happened to be an episode on cell phones. Mm-hmm. And so, of course, you and I both know cell phones can be hacked. So I almost didn't listen to it. So I'm like, I know a cell phone can be hacked, but let me listen to it anyway. So I'm listening to the thing. And the guy's talking about Android. Some of the older Androids have an exploit within File Explorer, which is a program that on your device by default, which allows the phone to see files. And so this also highlights why you should always do updates when your phone says you need updates. Mm-hmm. So there's an exploit in File Explorer. And so the guy says, I'm going to use that exploit to get into your phone. And once I get into your phone, I can see everything. I can see the calls you make, your photos, even the photos you've deleted, I can see because they're cached and stuff like that. So just, the text message, the whole 9 yards. And I was like, well, that's interesting. And so the guy says, all right, so are you going to send me a text message or an email? And he says, I don't even have to send it to you. I can send it to anybody that's on the same network that your phone's on. Uh-oh. And if anybody clicks on that link and you're on the same network with your phone, it will identify that there's a phone on the network and that vulnerability exists, and I can get into that phone. So I'm like, so even if I don't get the email or get the text message, I don't get anything. I'm just connected to the same network that some other idiot decides to click the link on. It can compromise my phone.
Yet another reason we do phishing tests and try to get you not to click.
And think about all the phones. You come in to your office, everybody connects their phone to the Wi-Fi in the office because you want to, be on the office Wi-Fi. And if you have a vulnerability in your device and anybody on the network, anybody clicks, it can compromise your device. And you would not even know it because you didn't do anything.
Awesome.
I was like, wow, I have not heard that one.
Well, get your devices up to date, please.
Yep.
And it does. Oh, I don't ever click on anything. Well, now it don't matter. It don't matter.
Yeah. So now I'm like,
Don't connect to anything.
Yeah. I'm not connecting to anybody's Wi-Fi anymore.
I've gotten to where I don't on my phone anymore, unless there's something specific I'm wanting to stream, and I want to make sure that it doesn't buffer. But a lot of times my phone's faster than some of the Wi-Fi networks I go to.
Yeah. Yeah. Well, the other, make sure you have security on your device. I don't care what flavor it is, have antivirus apps on there, and don't get something obscure or, you don't know what it is,
free,
or some
the
other
free ones. The free VPNs are mostly like a massive number of the free VPNs are hosted in China, and they're looking at your traffic.
Yeah, I know.
So anyhow,
like,
we digress.
We did. Anyway, I'll just bring it up because the cell phone was brought up, and it was like, holy cow, I did not know that could happen.
Yeah. And see if David's surprised about things. And I love Hackable. I love it when they hacked his coffee maker or toaster or something and then sent stuff to his printer.
Yeah, I know. People just don't get it.
They were messing around with stuff. Yeah, there's a lot of that. And you don't even have to hack anymore with equipment. You can do it over the phone.
Mm-hmm.
Because everything is, and that's a whole nother story we watched on CNN. Tech reporter let a audio hacker attack him, and it was funny. Moved him to the back row of the plane in a middle seat.
Yeah.
That's awful.
Well,
anyway, so we're back to the security risk assessment and all of those kind of things because we're running out of time here. A couple of quick things when they talked about medical devices that I went, wait, what? The Philips PACS vendors, they had the engineers there and they were talking about things. And he made a point. He says, we can encrypt connections to systems that are doing the transmissions, but you got to know how to do it. It doesn't come that way by default. And they often plug in to like a hospital network and they start receiving DICOM, it's the type of images that come into the PACS system that's tracking all this. And they have to give them a list because most people don't know what's sending them out, how many different devices they have. And then this one was really, I'm like, holy crap, is that he knew of an ultrasound machine that came as a default that when you plugged it into the network, anyone on the network could connect to that device and pull the PHI off of it unless you knew to change that setting. Yeah. So don't think that medical devices aren't a thing. It's huge and it's getting worse. But that was some of the discussions, what NIST, ONC, OCR, they're working on together. There's a lot of projects. There's multiple privacy frameworks that are going on. One is the NIST that kind of goes right in line with the NIST CSF, which only says to me that that'll be the direction that everything's going, is to use those two. But another project that's been ongoing for years is the SRA tool. You know, that you can get a free security risk analysis. And there's a tool for it. Well, the first one was just, I don't know. It worked on an iPad, but that was about the coolest thing about it. And then they came out with 3.0, and it really is a lot better. And they just did 3.1, which continues to get better. And they had the developers up there showing you how cool it was and all of that. But the bottom line is, after the questions and answers, it was kind of deflated the poor developers because it's like, but the bottom line is, after much discussion and a lot of questions, and the panel essentially ends up saying, okay, this is really the best fit for small practice that has had their head in the sand and is not going to do anything else.
Yeah. You don't have, the money to bring in somebody to do it, whatever. Well, here's a way you can get it done for free. But don't forget, it is free.
Well, and another point they made is you use the tool, but there are places that you attach documentation. And that documentation is stored with your risk analysis to show you've done the work. You didn't just guess.
Right.
And most people aren't putting the documentation with it, which then kind of negates the use of the tool. these were some questions about the tool and some answers. Somebody asked, they were asking, is it a get out of jail free card with OCR if we use it? No. No.
Yeah, I could answer that one.
Wrong.
Yep, wrong.
In fact, they don't even expect you to use it. The other point is they wanted to make it very, very clear that it is not a low pro-co assessment. Don't use it to determine breach notification. They even said, well, how is it? The tool looks at risk areas in aggregate, meaning it lumps everything all into one. So a larger organization, I think the way they said it was, we'll have to analyze other things, not in the tool individually. They would have to add documentation showing you that they looked at additional ones outside of what's in the tool, because it won't be enough for a large organization.
Mm-hmm.
And they made a point yet again, multiple times, documentation is how you show the work. Without it, the tool is just basically a checklist.
Right.
But again, small providers, head in the sand, they don't understand. They're just getting started. That's what they should use. But if you're trying to do like a real, no. It's designed. You can add as much you want to it, and a large organization can use it, but it's not designed for that. It's a tool. It's not a solution to doing an SRA.
Mm-hmm.
So over and over and over, this is about small providers. You get a report from the tool, but you still have to include the appropriate documentation to show that you're doing the work, like a policy and procedure, a operational evidence document that shows you're doing patch management, those kind of things. So I thought that was really interesting that they are making it better, but in the end, it doesn't really do what you need to do it the right way.
Mm-hmm.
It doesn't do what you do. So that's 2 full days of sessions, and we couldn't cram everything into an hour. So we might bring up some others. We'll definitely do a separate thing on hiccup, because we've only done like 1 or maybe 2 at the most, and that was at the beginning of the year, and there's a lot more uses for it, and there's a new supply chain guide, and there's all kinds of stuff.
Yeah.
So, but HIPAA is the floor, not the ceiling.
Yeah. If you don't take anything else away from that.
Right. And train.
Yeah. And we say that every episode. Yeah.
Yeah.
But just the whole HIPAA is the floor thing should shake some people up.
Yeah. Especially when the director of the Office for Civil Rights is saying it.
Yeah. Because all we hear is we're striving to be HIPAA compliant. So we're striving to be at the floor.
Yeah. And HIPAA compliant makes us cringe. So lots of good stuff, though.
Yeah.
And, things that I'm adding or updating or thinking about, how can we work with that, and knowing where we're going with the vast amount of data, and that you constantly have to reevaluate where is PHI. That's why you have to do risk analysis. And the panel was asked, how often should you do it? Multiple times. And it's like constantly, it's not a one and done thing. Mm-hmm. It's not something, one person even said, you hire a new employee, you get a new phone, there should be some level of a risk analysis there.
Yeah.
So there you have it.
Mm-hmm.
What else did you get other than HIPAA's the floor?
I mean,
when you were able to participate.
Yeah. Pretty much all the same stuff that we've covered. We didn't miss anything. A lot of discussion. A lot of it's about changing the mindset, I believe, of people. And even the whole point about HIPAA's the floor, it's all about understanding that what was okay and what was great a few years ago is not anymore. So our efforts continue to show fewer positive results, even though we're doing the same amount.
Right.
So, HIPAA, you could argue that HIPAA was the gold standard a few years ago, and now they're saying it's the floor. Well, that's because the threat landscape is changing. The difficulty in protecting the data is changing. what we're seeing happening is changing. And so you can't just say, well, what we did 5 years ago is great. Everything still works. It has to be constantly reevaluated, and not just your compliance program, but everything around protecting patient information and providing patient care has to be constantly evaluated.
Right. So if you're not meeting your HIPAA obligations, which is the floor, you're not even in a building to protect things. You're just standing out in the middle of a field.
Cornfield.
Yeah. Out in the middle of the cornfield. That's where you are.
Yeah.
Just letting the drones come at you.
All righty. That is our show for today, folks. We hope you like the show. Make sure you follow us and share us out on your favorite social media. Rate us on our podcasting app. We do need your help to continue to spread the word. And remember, as always, for Donna and myself, that HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.